Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Jim Barrett, who is the Executive Director of Pisgah Legal Services. Welcome to our program today, Jim.
Thank you.
Jim comes, he has been the Executive Director of Pisgah Legal Services since 1993 and has served on the staff there for more than 37 years. Under Jim's leadership, Pisgah Legal Services has grown to become a leader in the nonprofit sector, not only providing legal services to clients, but improving public policies across North Carolina and leveraging millions of dollars to improve life in Western North Carolina. We are so excited to have you, and I always enjoy meeting these executive directors and learning about your nonprofit. So why don't you start by telling us a little bit about what is Pisgah Legal Services and what do you do?
Well, thank you. We're so glad to be interviewed and get to spread the word about what we do. It's interesting that the Pisgah Health Foundation and the Pisgah Legal Services have such overlapping missions, and helping people improve their health is a big goal of Pisgah Legal Services. We are a 501c3 nonprofit law firm, locally based, community based, and we serve Western North Carolina. We give our clients free civil legal services, non-criminal, and you might know that the U.S. Constitution gives one a right to a criminal defense, a free attorney if they can't afford one. But the same thing doesn't happen if you're a victim of domestic violence, or if you're about to lose your home, or if you are homeless due to disability. So in order to provide legal services to people who cannot afford to pay for it, nonprofit organizations exist around our country to help people meet their basic needs. And our board of directors, including representation from Transylvania and Henderson County and other counties in Western North Carolina, those board members have set 4 main priorities for us, and those are to help people improve their health and access health care, escape from domestic violence and child abuse, improve their housing stability and affordability, and increase their incomes. So our various programs, whether it's children's law or elder law or veterans law or any number of areas, immigration included, are all designed to help people meet those 4 essential necessities. And without those, you can't thrive and have a good life. So our work is primarily in 11 counties, including Transylvania, Henderson, Buncombe, Madison, Rutherford, and several others. And we have immigration law services for 18 Western North Carolina counties. Those services are very thin because we only have 2 lawyers doing that work. And we're the only free legal aid for immigrants west of Charlotte. So those services are in great demand, as are the others. The challenge is there's over 200,000 people eligible for our services because they're so low income. And with the pandemic, we think that number is over 300,000. And so although we are close to serving 20,000 people a year and might do that this year, there's a lot of need. So we have about 80 staff, and then we have 300 volunteer lawyers and about another 100 volunteers who are not lawyers. And we help people with earned income tax credit, tax returns. We help people access the Affordable Care Act health insurance plans because those are very hard to do on the internet for some people. And then we provide free civil legal services. So we're very busy across the causes of poverty, and we love our work because it's so needed and we can make such a difference.
It's really incredible to hear how much you're touching so many different social determinants of health and crossing that spectrum. And so that's really amazing. Jim, to just think about the breadth and the depth of what you're doing. And you use that language to help people with basic needs, things that we might not typically think about leveraging a lawyer for support in along the way. Jim, how has the grant that you've received from Pisgah Health Foundation, how will it help you as you're serving Western North Carolina in all of these different areas?
So we have a considerably large budget, as you might imagine, and there's a lot of need. So we pieced together foundation support and individual donor support, churches support, government contracts. All those together help us with our various programs. And particularly those are helping us address people's housing needs right now in the pandemic, because even before the pandemic, we had a housing shortage that was terrible. And so many people were paying more than half of their income for rent, when the government says what's affordable is paying only 30% of your income for rent. So now it's even worse. And thousands of people, probably tens of thousands of people in Western North Carolina, have lost their jobs or lost income because of unemployment rate going up. And our tourist economy, of course, has been hit really hard. People aren't traveling as much. So the grant from Pisgah Health Foundation and other support that we're getting right now is helping people in great need due to the pandemic. I was reviewing cases today that we were helping people with, and you can't believe the stories. People who are, they've been injured and then went to the hospital and accidentally got COVID, and now they're out of work, and you just can't make these situations up. They're so difficult for people, and yet people are fighting through these problems, trying to keep their businesses going. And we're honored to be able to help them when we can. And one of the things we're helping with is helping to administer some of the rent assistance programs that are available to people, and match the people who are most threatened with eviction with these sources of income. So I said to somebody the other day that I felt like our work in helping people through crises, economic difficulties, was over 42 years of our existence, was maybe just to get us prepared for this, because who knew we would have this much of a challenge in our country.
It's incredible just to hear you think about and describe the magnitude of what we're seeing right here in Western North Carolina. And I'm sure that most of us, the average person on the street, just doesn't understand all those many dominoes that you see day in and day out. So Jim,
it's easy to miss it because nobody is walking around saying, woe is me. Everybody is keeping their chin up and trying to do the best they can, but there's a lot of stress and suffering underneath that.
right.
Stress because we can't have Thanksgiving dinner with our family, but I'm not worried about paying my mortgage or meeting my bills. But
Right.
many people are. I hope that a lot of people will look into the Affordable Care Act health insurance options right now, because a lot of people, I think more than several 100,000 people in North Carolina have lost their health insurance when they lost their jobs. So they may not realize that they can get health insurance that's affordable through the Affordable Care Act, but they got to do it by December 15th, because that's the deadline for getting 2021 plans in place.
Okay, so just a little bit more time there before those
Yep.
options are no longer available. So,
And we have about 35 staff and volunteers helping people look online to shop for those insurance plans. It's really not easy. It's hard to shop for those things.
oh yes, the layers of complexity. Jim, where can people find out more information about this and many of the other things that you're doing? And what else would you like our viewers to know for how they can get involved, how they can support, or even how can they leverage some of the services that you're providing?
Well, as I've said, a lot of people who need us don't realize that we're there for them. And a lot of people don't realize that we need financial support to keep doing this work. Even before the pandemic, we were serving most of our clients by telephone. And so they can just call us at our main number, 828-253-0406. And they can get in line and for screening and see if we can help them. We're also taking extra calls now for people who need rental assistance or utility assistance. And unfortunately, we can't help all that need it, but we're trying to keep people from having utilities cut off. And we've helped a lot of people in the last few days who were disabled or elderly, because there's a moratorium on those during the wintertime, but people don't know about it. Just a lot of rights and responsibilities in our complex society that people don't know how to deal with, especially if they're undereducated or maybe they have mental health problems or all kinds of difficulties. Senior citizens sometimes are in more need of help and they don't know where to turn. So we're grateful to be able to do it, and we appreciate the Pisgah Health Foundation getting out the word about our services, because it really is a shame if you're in need of it and you don't know about it.
Right.
We could have made such a difference. And that's what drives me all the time, is that I know what will happen to people if they don't get to us. So it makes me want to serve more and more people and raise more and more funds so that we can do that.
The power of educating the public around what you have available there and those rights and the different opportunities that you're serving. Well, Jim,
Right.
on behalf of the Board of Directors of Pisgah Health Foundation, I do want to say thank you to you and the rest of the staff and all of those volunteers who are working so diligently at Pisgah Legal Services to help make a difference in the lives of Western North Carolina residents. We are super grateful for the work that you and your team are doing there.
Well, thank you. Our website is pisgahlegal.org, and we can have a new way for people to apply for our help online. So if you see somebody who needs our help, you can help them apply online, and that'll may be a little more efficient than them trying to call us and get through the call waiting that they would have to do.
Fantastic. Well, Jim, thank you so much for taking time to be on our program today, and thank you again for the work that you're doing. We also want to thank Wildflower Media for their technical and creative support in bringing these videos out to you, our viewers, and to the staff and the Board of Directors at Pisgah Health Foundation, as well as to the Physicians Roundtable. We say thank you for all of the work that you're doing to serve Western North Carolina. Until we see you on the next Pisgah Health Today, stay well and be well.
Thank you.